I am Dr. S. Dhanraj Reddy, consultant pathologist and HOD laboratory and blood bank. So today I will be talking about the safety policy in blood bank. So transfusion in blood bank stresses more on the procurement of the blood and as well as the processing of the blood. So procurement of the blood is very important in obtaining the safety policy in blood banking services. So to obtain a safe blood in the blood bank, the selection criteria of the donors is very important. So the main policy is to give the donor or the patient effective and safe blood. So to obtain this, we need a selection criteria which is mainly done by a medical officer in the blood bank, or if it is not available, it is done by any senior technician. So what is the selection criteria to obtain a safe blood of the donor to transfuse to the patient? So mainly the selection criteria is the age of the patient. The age of the patient should be between 18 and 60 years old, and the weight of the patient should be more than 45 years. So apart from this, we should have a general history to be taken on the donor, such as unexplained weight loss or unexplained fever, or history of any skin infections or any lymphadenopathy or any chronic infections. Such patients has to be deferred from blood donation. So apart from this, a history of drug abuse or drug intravenous administration or history of recent transfusions, such patients also has to be deferred from blood donation. So what is the other main criteria for selecting the blood donor for effective safety policy in the blood banking services? So apart from the age and the general infections, the criteria which has to be deferred immediately before transfusion is the history of the blood donor. So the first and the foremost history should be asked about any chronic infections, such as especially typhoid. So patients who have infected with typhoid has to be deferred for a period of at least 12 months. And the same similarly, history of hepatitis, such patients has to defer from a period of 12 months. So mainly if it's a female patient, the history of abortion is there. Such patients should be deferred at a period of 6 months. And in case of post-delivery breastfeeding female is there, she should be also deferred for a period of at least 12 months of period. Then only she can transfer blood. So apart from this, history of any diabetes or hypertension. If his diabetes and hypertension are well controlled after treatment, such patients can be taken for blood transfusion. So apart from this, these are the temporary deferment of the blood donors for transfusion of the blood. But there are some conditions where the patient, the donor has to be deferred completely during lifetime. So what are the other conditions where the patient has to be deferred totally? So patients who are suffering from cancers or who are on chemotherapy or radiotherapy, such patients has to be deferred from blood transfusions. And apart from this, other chronic infections like hepatitis or patients of diabetes who is on insulin dependent has to be deferred totally from blood transfusions. Some patients who suffering from this epilepsy or asthma, so such patients also has to completely abandon from the blood transfusions. Some patients will have some unexplained weight loss or the history of any bleeding tendencies. Even such patients has to be stopped from blood donation completely throughout their life. And apart from this, some patients have tattoos in their bodies. So such patients can be deferred only for a temporary period of only 6 months to 1 year. So patients who have recently been immunized, even they has to be deferred for a period of at least 15 to 20 days. So this is the main selection criteria for the donors to get the effective blood to be transfused to the blood bank. So apart from this selection criteria, this processing of the blood. So processing of the blood is a very important aspect in the blood banking. After the collection of the blood from the selected donor, the blood has to be collected under aseptic precautions by the concerned technician. After the phlebotomy is there, blood has to be processed. It has to be separated into components under aseptic precautions. And after the separation of the components under aseptic precautions, the blood has to be preserved in the blood banking in the optimum temperatures, because we are preparing several components. So depending upon the component, the optimum temperature has to be maintained in the blood banking. Then only we can give the effective and safe blood to the patient. So apart from processing of the blood and also mobilizing of the patients, the post-phlebotomy care is also very important for the safety policy of the blood bank. So once the phlebotomy is over, we should not just leave the patient ahead. So we should see that patient is completely well before leaving the blood bank. And immediately after phlebotomy, the pressure should be applied on the site to avoid any undue bleeding. and the donors has to be advised after phlebotomy not to smoke for at least a period of 1 hour and not consume any alcohol for the coming 24 hours. And is advised to take plenty of water for the coming 4 hours. So such measures has to be taken even after donation of the blood. So to summarize, the selection of the criteria, the processing of the blood, and the post-phlebotomy care of the donor is very important in maintaining the safety policy in the blood bank. Thank you.